Hello and welcome. Today we're diving into the urinary system and exploring a condition called obstructive uropathy. This is a broad term describing any blockage that interferes with the normal flow of urine, potentially causing significant damage to the kidneys and urinary tract. So, what causes these blockages? The etiology of obstructive uropathy is diverse. Kidney stones are a very common culprit, obstructing the ureters or bladder neck. Enlarged prostate or benign prostatic hyperplasia is a significant cause in men, compressing the urethra. Tumors, both benign and malignant, in the urinary tract or surrounding organs can also lead to obstruction. Less common causes include strictures, which are narrowings of the urethra or ureters often caused by scar tissue from previous infections or surgeries, congenital abnormalities present at birth, like uropelvic junction obstruction, and neurological conditions that disrupt bladder function, leading to urinary retention and backflow. Now, let's understand the pathophysiology. The obstruction increases pressure within the urinary system. This back pressure, particularly in the kidneys, is called hydronephrosis. Hydronephrosis can lead to kidney damage by compressing the kidney tissue, reducing blood flow, and impairing its ability to filter waste. Over time, this can cause irreversible kidney damage and even kidney failure. Additionally, the stagnant urine can become a breeding ground for bacteria, increasing the risk of urinary tract infections. The severity and speed of damage depend on the location, degree, and duration of the obstruction. Epidemiologically, obstructive uropathy affects people of all ages, but the specific causes vary with age and sex. Kidney stones are more common in adults. Benign prostatic hyperplasia is primarily seen in older men. Congenital abnormalities are, of course, diagnosed in infants and children. The overall prevalence is difficult to pinpoint, as many cases may be mild and undiagnosed. However, severe obstructive uropathy requiring intervention is a relatively common urological problem. The signs and symptoms of obstructive uropathy can be subtle or dramatic, depending on the severity and location of the obstruction. Some people may experience flank pain, which is pain in the side or back, usually associated with kidney issues. Urinary frequency, urgency, and nocturia, the need to urinate frequently at night, can also occur. Difficulty starting urination, weak urinary stream, and a feeling of incomplete bladder emptying are common with obstructions at the bladder neck or urethra. In severe cases, patients may experience oliguria, or reduced urine output, and even anuria, a complete lack of urine production. Other symptoms can include blood in the urine, known as hematuria, and recurrent urinary tract infections. Diagnosis typically begins with a thorough medical history and physical examination. Urinalysis can detect blood infection or abnormal cells in the urine. Blood tests, such as serum creatinine and BN, assess kidney function. Imaging studies are crucial for identifying the location and cause of the obstruction. Ultrasound is a non-invasive and readily available option, particularly for detecting hydronephrosis. CT scans, with or without contrast, provide detailed images of the urinary tract and surrounding structures. An intravenous pyelogram, or IVP, is an X-ray using contrast dye to visualize the urinary tract. Finally, a cystoscopy, which involves inserting a small camera into the bladder, can directly visualize the urethra and bladder lining. Obstructive uropathy can be classified based on several factors. By location, it can be upper tract obstruction affecting the ureters or kidneys, or lower tract obstruction affecting the bladder or urethra. By degree, it can be partial or complete. By duration, it can be acute, meaning it develops rapidly, or chronic, meaning it develops slowly over time. Considering the etiology, it is also common to categorize based on the causative factor, obstructive uropathy due to kidney stones, BPH, tumors, etc. The primary goals of treatment are to relieve the obstruction, prevent further kidney damage, and address the underlying cause. Treatment options depend on the location, severity, and cause of the obstruction. For kidney stones, options include observation with pain management, medications to help pass the stone, extracorporeal shock wave lithotripsy SLL to break up the stone, or surgical removal. For BPH, medications to relax the state or surgery to remove part of the prostate are common. Tumors may require surgery, radiation, or chemotherapy. Strictures may be treated with dilation, stents, or surgery. In some cases, a temporary urinary catheter or nephrostomy tube, which drains urine directly from the kidney, may be necessary to relieve pressure and prevent further kidney damage. While it's not always possible to prevent obstructive uropathy, some measures can reduce the risk. Staying well hydrated can help prevent kidney stone formation. Maintaining a healthy weight and lifestyle can reduce the risk of BH. Regular medical checkups, including prostate exams for men, can help detect and treat potential problems early. Prompt treatment of urinary tract infections can also help prevent complications that could lead to strictures. The prognosis for obstructive uropathy depends on the severity and duration of the obstruction, the underlying cause, and the individual's overall health. Early diagnosis and treatment can often prevent permanent kidney damage. However, long-standing or severe obstruction can lead to chronic kidney disease and kidney failure. Recent research focuses on developing less invasive techniques for treating obstructions, such as improved endoscopic procedures and novel medications. Advancements in imaging technology allow for more precise diagnosis and treatment planning. Understanding the genetic factors that may contribute to certain types of obstructive uropathy is also an area of ongoing research. By continuing to advance our understanding and treatment strategies, we can improve the outcomes for individuals affected by this condition.